Good afternoon, everyone, and welcome to this month's Employee Benefits Compliance webinar. I am Jenny Badeau with AssureXglobal, and thank you for joining me here today. Today, the experts from BenefitComply will be providing us with a regulatory and legislative update, as we often do as we're kind of getting into the year. And as we are starting today, and as folks are still joining, you will see a polling question pop up on your screen. We are curious if your company is implementing an alternative provider network. So you'll see a list of options on your screen. Please check any that apply to your company. And if you are not taking this action, if you scroll down, you'll see a none option. So as those responses are coming in, I'll cover a couple of other items. First, I'd like to extend a special thank you to your local insurance benefits advisors and consultants who are partners of AssureXglobal for making today's webinar possible. And we do welcome your questions today. So if you have questions at any time during the presentation, you can submit those over to us using the Q&A function at the bottom of your screen. And as a reminder, our sessions are recorded, and a link to the recording, as well as a copy of the presentation slides, will be available from the benefits advisor who invited you here today. They should have that early next week. And I will drop a link to the presentation slides into our chat section here in just a moment as well. I'm going to let the poll sit up for just another few seconds here. It looks like we've still got some responses coming in. And we're seeing, probably not surprisingly, most of you saying you're not implementing any of these options as it stands today, but we are seeing some of you telling us a narrow network or tiered network might be what you're focusing on. But I'll share these results out here with y'all in just a second here. And I will let you know we do have a polling question at the end of our time together as well, so please do stick around for that. Okay, let me share these out. So I kind of gave you the sneak peek, so you'll see where the responses lay here. As always, we do appreciate you sharing your feedback with us. It's just great to get a pulse as to what's on your minds and how you're approaching various aspects of your benefits program. But now let's get into today's presentation. We have from the BenefitComply team, Regan Debin, principal, as well as Amanda Olem, senior consultant. So Regan and Amanda, I will let you take it away.
Thanks, Jenny, and thanks so much for letting us be here today. Interesting to see looking at those poll questions, and I think lots of us trying to figure out what to do. And many of you, I don't know if you're feeling this way, but just watching all the potential changes and different things that are going on, you know, what decision should we be making right now, and should we kind of be hold on to things and see how things play out over the next year or so? Hopefully the conversation that we're going to have today will help you just be kind of thinking about big picture, where to focus efforts and where to maybe kind of hold on and see how things shake out. We do a lot of these regulatory legislative updates, try and do those periodically every quarter or so. And a lot of times we're digging into some of the latest laws that have been passed or specific regulations that have come out or have been changed and that are going into effect. And we're going to take a little bit different tack today. What we want to talk about instead is this compliance framework that's illustrated here, and talk about all the different places that we get guidance and laws and regulations at the federal level, and then a little bit at the state level as well, and talk about kind of the interplay of all of these different things and what we're watching to really ultimately understand what we have to do around compliance for employer sponsored benefits. So of course, with the new administration, we've all been watching the executive orders that have been coming out since President Trump took office earlier this year. Those executive orders don't really have any immediate impact or change, but they do just highlight kind of their agenda. These are the things that are important to us. These are the things that we're focused on. They also provide direction. So the federal agencies, they are being directed by the executive branch. And so it's directing those agencies. Here's where we want you to focus. Here's where we want you to provide guidance. Here's where we want you to write rules. Here's where we want you to maybe within the existing framework, take further enforcement efforts. So those are definitely connected, and we'll watch kind of how the current executive orders, what ends up happening in regard to actual agency action. When we talk about federal agencies, specifically for employee benefit compliance, think of the Department of Labor, the DOL, Health and Human Services, the Department of HHS, Centers for Medicare and Medicaid Services, which is kind of a sub branch of that. CMS is another one. And then, of course, the Department of Treasury, the IRS weighing in. Those are the kind of key agencies that we really watch to see what they're saying, what they're putting out around what we're supposed to be doing with the benefit offerings. Then, as we're also watching this messaging around trying to pull back some of the federal regulation, the idea of deregulating a bit, what then happens is they defer to states, giving states more room and more power to potentially roll out what might be appropriate in their particular area and to govern different things. But then that also means if we're not under kind of a national standard, that we have to watch what the different states are doing and make sure that depending on where our benefits are located, where the participants are located, that we're following the appropriate state laws and regulations as well. So that's something that we might see shift even more so in the future based on the current administration. Then we always have to watch the court decisions. They're interpreting federal laws and state laws. They're also potentially pushing back on different interpretations that we're seeing by the agencies. So we're watching that both at kind of lower district court level and circuit court level, as well as the Supreme Court. And Amanda's going to kind of tell you about what we're seeing there or expect to see yet this year. And then finally, congressional laws. So this is the Senate and the House as they are putting forth legislation and ultimately what they're able to come to agreement with and pass. Those are the things that, when they push into law at a kind of a high level, obviously we have to follow at a national level. So these are not in any particular order. This is just all of the different pieces that ultimately make up the puzzle and the framework of what builds out the compliance rules that we have to follow for employee benefits. And so now I'm going to turn it over to Amanda and let her really dig into each one of these, and we'll tell you the things that we've been seeing so far and the things that we're watching and ultimately what that could mean as far as potential changes or enforcement or just more of the same even is a possibility as well. Both for this year and then going into next year as well, because it certainly takes time to make changes. So with that, Amanda, I will turn it over to you.
Awesome. Thank you, Reagan. All right. So we're going to start with the executive orders. I think these have kind of been in the forefront. They've definitely been in the news and on social media quite a bit. So before we get into the specifics of the ones that we have seen that impact the employee benefits world, we just kind of wanted to go over a little bit what they're all about. So first of all, executive orders in general typically are aiming to kind of do three different things. First, like Reagan kind of touched on already, they will typically establish the current administration's enforcement priorities. So this could be that they are kind of picking up the torch on something that already exists, or maybe they are telling the federal agencies that that isn't as much of an enforcement priority, and we have seen both from the executive orders that we've gotten so far. Second, they are aiming to impact the guidance that the federal agencies put out in accordance with the specific administration's policy objectives, and we've definitely seen that from the executive orders so far. And then finally, the executive orders will, in many cases, revoke a prior administration's executive orders. Again, we have seen that with the ones that have been put out. That said, I think there's almost this kind of misnomer out there that when the executive order comes out, it's law and it immediately will impact things. That isn't the case. Going back to your high school government class, you may remember checks and balances. We still have those in place. So at the end of the day, the executive orders do have limits. They have to be both constitutional and statutorily legal. And if they're not, the courts can block their implementation. And in addition, if Congress wanted to essentially make them so that they're no longer statutorily legal, Congress can go ahead and pass legislation in response to an executive order, essentially invalidating it. Because of that, executive orders are not going to have an immediate impact in most cases. First of all, they have to survive those limits, those checks and balances that we just discussed. And then second, even if they do survive those checks and balances, typically they are kind of, again, a direction, for example, to the federal agencies, and will depend on the federal agencies actually taking that action that the executive order laid out. So at the end of the day, all these executive orders that we are going to discuss will likely have some kind of impact, but it will typically not be immediate. So jumping right in, the first executive order that we're going to discuss here is called Protecting Children from Chemical and Surgical Mutilation. So the potential impact that this executive order could have, what it was aiming to do, was stop federal funding to hospitals that provide gender-affirming care. When we say gender-affirming care, typically that is care that is being diagnosed to individuals or provided to individuals that have been diagnosed with gender dysphoria. And so the executive order was attempting to stop the federal funding to hospitals if they provide treatment for that kind of thing. In addition, the executive order was aiming to exclude coverage for that type of treatments in the federal plans. So the federal employee health plans, TRICARE, and then also the federal health plan for postal workers. At this point, the executive order is essentially put on hold. There was a federal district court, I think out of Maryland, that actually put a preliminary injunction on this, stating that the president doesn't really have the power to unilaterally stop federal funding in that way. And so the question that I have up on the screen there, right when this came out, we were taking a lot of questions from employers asking, okay, should we update our plan to have some kind of an exclusion for this kind of care? First of all, as the executive order has a preliminary injunction on it, we wouldn't really recommend moving on it. But even beyond that, again, just looking at the actual aim of the executive order, it doesn't actually touch on a lot of the items that we had been discussing regarding why those types of exclusions from a plan may be problematic in the first place. For example, Title VII, after the Bostock Supreme Court decision where they opined that gender identity could also be a protected class, there were several courts that specifically applied that decision to group health plans that had exclusions for this type of care. And again, this executive order doesn't do anything to kind of negate those concerns that we still have for specific exclusions that may be in a plan for that type of care. Not to mention, we do still have Section 1557. That one's a little bit more complicated as it does actually apply directly to, not typically directly to group health plans, but instead to covered entities, so your TPAs, things like that. And then finally, mental health parity and the ADA may also provide some kind of protection for this type of care. Staying on kind of the same theme here, the next executive order is Defending Women from Gender Ideology Extremism and Restoring Biological Truth to the Federal Government. So this one was really aimed at providing specific definitions for the words that I have on the screen here: sex, men, women, male, female, and further directs the federal agencies that when these words appear in any of the statutes or regulations that they're interpreting, that they should give those words the meaning that the executive order defines them as. So at the end of the day, kind of taking out the gender identity and going back to what they are calling biological truth. So The other part of this executive order is they also had a little piece in there similar to the one that we saw before, stating that federal funds should not be used to promote this gender ideology. And this was also actually a part of that preliminary injunction that we just discussed in the prior slide. That second bullet point there, directing the federal agencies to give the terms and meanings set forth in the executive order could potentially have an impact on Section 1557. That's been in and out of the courts already in regard to the interpretation of discrimination on the basis of sex. And so this could potentially have an impact on that and whether or not, for example, TPAs would be more willing to include exclusions in plans that they're administering for gender affirming care. Okay, kind of switching gears here, the next executive order is titled Making America Healthy Again by Empowering Patients with Clear, Accurate, and Actionable Healthcare Pricing Information. This one is really surrounding transparency requirements. When you read through the executive order, it seems pretty clear that this is going to be a priority for the Trump administration. It actually goes through and referencing some of the already in place transparency guidance that we have, such as the requirement to publish machine readable files with pricing and reimbursement data and provide consumers with price comparison tools. The executive order is taking the position that the Biden administration actually didn't do enough to enforce these requirements. So this is an instance where we are seeing an executive order, one, kind of establish their enforcement priorities, but also directs several of the federal agencies to further implement and potentially expand the federal transparency regulations that are in place. So again, no immediate changes, but I think that this this tends to be a topic that is popular on both sides of the aisle. So it is possible that we would see further actions via regulations and potentially even new legislation in regard to this. One thing to point out, typically the transparency requirements at the end of the day are kind of falling more on the carriers or the TPAs, the claims administrators. So hopefully we will continue in that way, but as we all know, it doesn't completely exempt the employers and the plans, right? We still have to deal, for example, with the RxDC reporting, and it's possible we will get more items to further enact this transparency. The next is called Enforcing the Hyde Amendment. So very briefly, the Hyde Amendment essentially prohibits use of federal funds for elective abortions and actually defines what is considered an elective abortion and includes exceptions to what would be considered an elective abortion. So this executive order is essentially reinstating the administration's commitment to that Hyde Amendment. It also revokes 2 Biden orders that were aimed at expanding abortion access post-Dobbs decision. The Dobbs decision was a decision that overturned Roe v. Wade. Those 2 executive orders by Biden, the first was just reiterating enforcement of the Freedom of Access to Clinic Entrances Act. And then the second was aimed at making Medicaid funding available to pay for travel costs for elective abortions for individuals in states where elective abortions were no longer legal. So those 2 have been revoked as a result of this executive order. And so just bringing that up because you may see questions from employees. There may be further interest from employees in trying to get coverage from group health plans for that, or it could go the other way, right? But I think we definitely could see some changes in what is required for Medicaid, for example, to cover abortions within states. The last executive order here that we'll discuss is expanding access to in vitro fertilization. This was the shortest of the ones that kind of impacts the employee benefits world. Really, it's just a kind of a policy statement that the administration is coming out and saying that they are looking for recommendations for policies to protect IVF access, and then also to reduce out-of-pocket and health plan costs for IVF treatments. And so we'll see. I'm not sure exactly what that would look like, but it could potentially impact health plans if we do see some agency movement on that and some further regulations on expanding that.
I was just going to pop in and say, just generally on these executive orders, a little bit interesting that we're just seeing a lot more of these than we have historically. And this is not from a particular party. We've seen this in the last several rounds of presidency and in both parties, that this is just another way that they're choosing to exercise their power. Whether that's appropriate or not is exactly what we're seeing play out, where they're being challenged by the courts and saying this isn't appropriate, you can't be pushing this out in this way, or you can't actually change things or change the laws using this particular method. So we'll see what happens with that. For now, it certainly gives us a good sense of what the current administration is focused on. You'll see some things. I think the IVF is a good example, Amanda. We're seeing stuff at the state level. We're seeing stuff at the federal level. So, those are just topics that we need to be watching. And hopefully you're understanding here that with most of these executive orders, although it is a kind of giving us a good sense of things that they're going to focus on and where we may see additional guidance and regulation and enforcement, nothing has really changed in any big way yet. And even if it's arguing that it's trying to change something, we're seeing pretty quickly that those things are being challenged in the courts, and then we have to wait and see what will really happen. Now we'll kind of get into some of these other pieces that Amanda's going to talk about. These are the places where we may really see some impact.
Exactly. The executive orders are, like Reagan said, kind of the directives to, for example, the agencies and the regulations that they put out. So we had a couple examples there of the administration's, at least the policy that they've put out, that they want to expand potentially regulations in some areas. That is a little bit counter to, I think, the administration's just general outlook on regulation. In general, this administration is so far focused on deregulation and potentially less enforcement. So first of all, there was an executive order that came out that has established this 10-to-1 policy. The order specifically states that whenever an agency promulgates a new rule, regulation, or guidance, it must identify at least 10 existing rules, regulations, or guidance documents to be repealed. Not exactly sure how that is going to look or exactly how it's going to be policed or enforced, but will definitely be interesting to watch. And there wasn't anything specifically saying that it all had to be from the same area, right? There are regulations kind of that governs a lot of different areas. And so, if we did get some additional regulations, for example, in transparency, where is that going to come out of? Not sure. In addition to this executive order, we've also seen a shrinking in general of the federal workforce. The Department of Government Efficiency, this has been all over the news and again, social media, has been working to shrink the federal workforce. And in addition, there has been an executive order that specifically states that agencies will be able to hire no more than 1 employee for every 4 employees that depart from federal service. So we may see this just having the impact of there being fewer enforcement agents out there to actually enforce the regulations. I think it's very important when we talk about the federal agencies and the regulations that they're putting forth to talk about this change in the balance of power that we have experienced just recently. So in general, when Congress sets out laws and statutes, that is the legislative branch, right, of our government, the federal agencies then, a part of the executive branch, step in to interpret those statutes. So the federal agencies, again, the ones that we deal with the most, Department of Labor, HHS, IRS, they'll step in to interpret those statutes. Now, historically, if those interpretations were challenged in court, if someone were to say that the federal agencies kind of overstepped or their interpretation wasn't in line with what was passed by Congress in the statute, the courts would defer to agency interpretations of those statutes in the first instance when determining whether or not they kind of overstepped. In 2024, we had this case, Loper v. Raimondo, kind of overturning that doctrine that we call the Chevron doctrine that has been in place since 1984. And now we are in a position where if agency regulations are challenged, the courts are not going to be required to defer to the agency interpretations. And this was a Supreme Court case, so this is now the law of the land across the land. Every federal court, every court can look at that statute without deferring to the agency interpretations. So what this means for us is just that those regulations may not be as safe, may not be as ironclad as they may have been in the past. The reason that we bring this up is because a lot of what we deal with on the employee benefits side of things here is regulatory in nature. It comes from those federal agencies. So at the top of the screen here, Section 1557, mental health parity, Section 4980H, which is the employer mandate of the ACA, and EEOC wellness. These are all statutes. These are things that were passed by Congress. In the smaller boxes underneath them are provisions of the law that most of these things are, whenever we get asked questions about how to comply with these statutes, we are looking at these regulations. These smaller boxes are all regulatory. So at the end of the day, after that Loper decision are just a little bit more tenuous. Whether or not they will continue to be the law of the land will remain to be seen, as it will be easier for courts to overturn these without having to give as much impact to that federal agency's interpretation. Just want to point out a couple of these for you. We're not going to go through all of them, but I think probably one of the biggest deals here for Section 4980H, the employer mandate, most of how the applicable large employers are determining full-time status of their employees is regulatory in nature. So the look-back measurement method. I know a lot of employers struggle with implementing that correctly, and it's maybe not always the most popular method that's been put out there. But the fact that you have only two methods to determine full-time status, either the monthly measurement method or the look-back measurement method, and all of the intricacies involved with the look-back measurement method, that's all regulatory in nature. Establishing the monthly equivalency of 130 hours of service, meaning someone is full-time, that's regulatory. Even the definition of an hour of service. So for example, when do you have to count an hour of service if someone is on call? All of this is regulatory in nature, and following that decision is in a little bit more of a tenuous position. So it's possible just in general that we could see more movement on things that we have kind of grown accustomed to. Okay, so now we're going to go through just some possible regulatory actions. We're not going to, again, a little bit different today. We're not going to look at any of these in depth, but just some things that we could see changing. So we got the Mental Health Parity Addiction Equity Act. The final rules, they've been challenged in court. So we will be looking at those to see what happens with those, if the agencies would potentially come out with any clarifications depending on the outcome of that court decision. You may remember just recently we received some pretty significant HIPAA security regulations. At the end of the day, they were kind of, in the agency's view, a restatement of what they believed plan sponsors were already required to be doing. But we only got the proposed. We haven't gotten the finalized. And so an open question at this point with a new administration is, you know, especially considering the smaller regulation, smaller enforcement kind of outlook of the administration, are they going to go through with actually finalizing these and potentially adjusting them? We could potentially see some creditable coverage proposed changes to simplified method determinations. So for purposes of determining whether or not a plan's prescription drug coverage is creditable for Medicare Part D purposes, you may remember there was potentially going to be, we were going to be getting rid of the availability of that simplified method for 2025. That was supposed to now happen for 2026. So we will be looking for clarifications on that. Increased transparency requirements, again, just based on that executive order that we covered at the beginning here, it seems like there is commitment to that as a policy objective for this administration. So I think it is very likely we could see some new regulatory action on that. And then finally, coverage requirements for preventive care. There is actually a Supreme Court case that I will be discussing later on that may impact this, that the regulators may want to come out and clarify. And then also for transgender care, like we talked about, abortion and infertility. Finally, states, at this point, every state has been putting forth some PBM regulations. So it is possible, especially considering in his first term that President Trump was pretty committed to lowering prescription drug prices. We could see this being an item of interest for the regulators.
With that, I just wanted to comment kind of on timeline for a lot of those things, because that is where the bulk of the compliance framework that we operate within, specifically for employee benefits, we really do get the bulk of that from agency regulations and FAQs and the likes. So this is something that we're watching really carefully to see, will they change existing regulations for those that are in proposed form? Will we see them finalized or changed, or will they do anything with them? Will we see new regulations? And we don't know what kind of appetite they have to really push more of this out versus different methods of regulating things. But I just want to talk just for a moment about timeline, because none of this is going to happen fast. So oftentimes the way that this works, sometimes they'll just start with a notice for comment and they'll say, here's what we're thinking about, here's what we're trying to interpret and give you further guidance and enforce, kind of what are your thoughts about how this could work best? They don't always do that, whether they do that first or not. Then what they will do is they have to put out proposed regulations. So they'll say, here's what we're thinking as far as how this is going to work and how we're going to enforce it and potentially when this is going to go into effect. And then they'll give us at least a 60-day comment period, sometimes longer, where everybody gets a chance to digest that and submit comments to the agency. Once that comment window closes, they'll consider all of those different comments that they receive. And then that can really take some time. Ultimately, decide whether to make changes to the proposed rules or not. And then we get a set of final rules. And then at that point in time, that's when they give us an effective date. And even then, when we get those final rules, that effective date will be pushed out into the future to give employers a chance to understand what the requirements are and potentially make any necessary changes to what they're doing with their plan offerings. So for example, it's often, first plan year beginning on or after, and then it might be, so So we might get something now and it would say plan years starting on or after January 1st, 2026, or maybe they'll say, you know, plan years beginning after a particular date. And so as we're watching these things, I just want you to realize that there is always kind of a longer window of time. For example, even those HIPAA security regulations, very significant, but they recognize that. And so if they do finalize those rules, they would then also give us a window to ultimately make whatever changes are needed and bring our plans into compliance.
Thank you. All right. So moving from the executive branch to the legislative branch, we are going to talk about congressional laws. So I just wanted to kind of take a step back, give you the lay of the land as far as the Democrat versus Republican split. But also I feel like I've been hearing the 60 votes being thrown around a lot, and wanted to revisit for myself exactly the filibuster rule and how it works, and thought maybe others would be interested in it as well. So first, just what does it take to pass a bill? Again, going back to your high school government class, it must pass both the House and the Senate. To pass the House, pretty simple, not going to spend much time on it here. It's just that you need a simple majority. That means 218 votes. So you'll see from the split here, the Republicans have it, but only just, meaning that if they want to get something passed from the House, they're going to need complete buy-in or some swing votes. Now, things are a little different on the Senate side. What it actually takes to pass a bill in the Senate is going to depend on the type of bill itself. Most bills that are in the Senate are going to be subject to what we call filibuster. Essentially, this means that the senators have basically a right to continue to debate and discuss a topic for as long as they want into perpetuity. Because of that, it kind of became this thing, and the filibuster has, you know, it used to be this thing that wasn't always used. It's kind of now always used by both parties. We had to put something in there to say, all right, at some point we need to be able to say, okay, we're going to call a vote on this, and that'll be the end of it. So that's where the cloture rule came in. So instead of when the filibuster is in place, and again, that's almost every bill, instead of a simple majority, in order to actually close the debate and call a vote, you actually need 60 votes. So you'll see that neither party has that. However, there are some bills that are not subject to that filibuster rule and actually can be passed by a simple majority. The most significant of those is the budget reconciliation. So as you can imagine, since, like I said, filibuster has kind of just become the norm at this point, and budget reconciliation is a lot more easily passed, it has become very tempting for both parties to kind of sneak as many things into the budget reconciliation as they can, because some would say, are kind of the only ways to get things passed, right? So we now have this rule that states that anything in the budget reconciliation bill has to actually have the primary purpose of raising or lowering spending or taxes. There has been some discussion of filibuster reform. I know President Trump has at least brought it up. I haven't seen anything recently saying that there has been any significant support on either side of the aisle for that. But that is definitely something to watch. If that happened, it may be easier to get things pushed through Congress and to have other types of legislation passed other than just the budget reconciliation. So with that in mind, just kind of wanted to talk through some potential congressional action. So the first 4 items here are all things that we could potentially see included in that budget reconciliation, which is why we think that they might have some viability going forward. So first of all, a reduction in Medicaid. When the ACA was originally passed, I think we're all pretty aware of the employer mandate portion of that, but a pretty significant part of the ACA was also this Medicaid expansion, which basically said to the states, if you adopt this expanded eligibility provision for Medicaid individuals, we will eventually, we being the federal government, will fund coverage for those individuals that are gaining coverage because of the expanded eligibility up to 90%. So at this point, anyone who has adopted that expansion and then anyone who is covered by Medicaid because of the expansion, the funding for those individuals is coming 90% from the federal government. This is something that we have seen talk of potentially rolling back. And again, at the end of the day, would definitely impact taxes or spending, so could end up in the budget reconciliation. Similarly, changes to marketplace coverage, specifically potentially eligibility for or the amount of the premium subsidies that we're seeing for individuals who specifically are not offered affordable
Jenny, I think Amanda froze. Can you see me okay and hear me okay?
Yeah, I can, Reagan. I think
Okay.
she did.
Okay.
Hang tight, everyone.
All right. We can always switch. She's running the slide decks in the background, so I can certainly jump in and help if needed. But I will just comment on some of the things that we're watching around the congressional action. Unlikely, or they have a hard time sometimes getting enough agreement, as Amanda was just illustrating, to ultimately get things passed. But there are quite a few things there that have some real bipartisan support and then could happen really quickly. And congressional action, unlike the regulatory things that we were just talking about previously, they could put things into effect retroactively. They could put things into effect immediately. We don't as often see kind of a long window unless there really is something that they think that it's unfair to put in place right away. So some of the things that we're seeing around telehealth and direct primary care and ultimately impacting HSA eligibility, we're watching that closely. They could potentially say it's retroactive back to the beginning of this year, and I think that might be really helpful. So we're just watching that, for some of the key things that we think have a real chance of passing because they could go into effect really quickly. The other thing that we're trying to watch is just things could get a little bit confusing. For example, we saw a piece of proposed legislation that said that they were going to continue to allow coverage for certain chronic illnesses as preventive without impacting HSA eligibility. And when I first read it, I was really confused, thinking, this is already the rules that we're all following. And then as you read the legislation, it specifically says we are just formalizing the information that we got in the IRS notice. So it is taking the rules that we're all kind of following under IRS guidance today and codifying it. And I wonder if we're going to see more of that, where there truly is bipartisan support or something that they really care about, so that those regulations can't be challenged and changed. Because when it is a law versus a regulation, it is not subject to those same challenges and would really take congressional action to change those things. So it's just going to be interesting. It may just kind of take a turn here, again, ultimately depending on whether Congress can get enough support to get some of these things through. And obviously the budget reconciliation is a piece of that, or a tool that they can use and have less bipartisan support and still have some things go through and ultimately pass. All right, well, without Amanda jumping back on here, I'm going to go ahead and see if I can pull up the slide deck.
Reagan, I'll give you a minute to do that. And why don't
Sure.
we just take this moment? I had a polling question that I was going to save for the end. So I'll give you a minute to pull that up. Why don't we use this time to just ask that polling question now? And thanks to our audience for bearing with us. Technology can always keep us on our toes. So the polling question I was going to ask you at the end that I will just ask us now is around employee affordability. So we are curious your perspectives on this statement. Our employees are having a more difficult time affording their benefits than 2 years ago. We actually had asked this question a couple of years ago, kind of mid-COVID, and we're curious how those responses have changed since then. So again, thanks for your flexibility, and we'll see your perspectives on this question today. Probably not shocking to anyone. I'm seeing a lot of strongly agree and agrees coming in so far. Yeah, it looks like a lot of you definitely are resonating with this. And I know there's a lot of different levers you can pull to try and help manage employee costs, trying to balance employee costs with affordability and your budget. If you attend a lot of our webinars, you probably notice we ask a lot of questions kind of addressing different angles of this, because we certainly know that these costs are top of mind, not just for you as the employer, but for your employees as well. All right, and thanks again for bearing with us here. I know we'll get back to the presentation in just a moment, but for now, let me share out this poll. Looks like our responses have slowed down. So as you can see, a lot of strongly agree and a lot of agree. So almost 3/4 of you are really agreeing with this statement. So as always, we appreciate you sharing your perspectives. Certainly, thank you again for your flexibility and allowing me to just pop this up now. It looks like Reagan's getting the presentation up. So Reagan, if you're ready, I'll pass it back over to you.
You certainly can. I probably won't cover some of this quite as well as Amanda did, but I'm happy to pop in and we'll go from here. I did just hear from her. It looks like things kind of completely crashed in the background and she's trying to restart. So just extra fun today. But we want to switch gears here for a moment then and talk about one of the things that we're going to see a decision on. The Supreme Court actually decided to hear a case in April, so just around the corner here, on preventive coverage. So they, in this particular case, decided at the lower levels. Ultimately, they had the parties were challenging the United States Preventive Services Task Force. That's one of the main groups or agencies that makes recommendations and updates things and says, here's what we think should really fall on the preventive list and be covered at 100%. And so they're updating, adding brand new things or updating kind of who it might be appropriate for as far as like age and gender and those types of things, maybe how often that we should be receiving different things. And so that particular task force, the argument was that those questioning whether their members are considered officers and whether they were properly appointed. And if not, then they shouldn't have the ability to ultimately make these recommendations and then have our group health plans be required to cover their recommendations with 100% coverage, no cost sharing. If they ultimately decide that this particular task force is not acting within their means, that would ultimately mean that any recommendations, new ones that they've made or updates that they've made since the ACA went into effect back in 2010 could potentially be excluded. So employers certainly could continue to provide that as preventive care. That many plans may decide to do that, but ultimately there would be more flexibility. There would be less things that would be on the list that absolutely have to be required to be covered with no cost sharing and considered to be preventive. And so we'll have to wait and see how this plays out. There has been lots of challenges around what really should be covered as preventive or not. Some administrations really trying to roll that back. The previous administration really trying to expand that. I think the current administration already was trying to roll back some of that. And certainly if the Supreme Court decides in favor of the plaintiffs, we would see even more of that. As far as if they ultimately decide in favor of the plaintiffs, what would happen? What would plans be able to do? Could they immediately stop offering these items without cost sharing? Probably not. The carriers have to file plans with the states kind of for the year and say, this is what we're going to offer. This is how we're going to cover things. So it would probably take, up through the next renewal to make changes to those. At the state level, We have coverage mandates, including some preventive coverage mandates. So certainly, at least for fully insured plans, they'd have to continue to comply with those at the state level, even if they don't have to at the federal level. And then even for employers with self-funded plans that may want to make changes, they certainly could make changes mid-year, but they'd have to give at least 60 days advance notice. So realistically, what we would expect is that a lot of employers would simply choose to make changes to their design and then roll it out with the next plan year. So anyway, this is one that we're watching. Like I said, they're supposed to hear it in April, and then we'll see how long, until they would ultimately issue an opinion. The other thing that we've really been watching is around ERISA breach of fiduciary duties. The Johnson & Johnson case, as well as a recently filed case for JP Morgan. So far, this has really been about prescription drug coverage. I know that's just a hot topic. That's what these have particularly been focused on. And looking at employers, specifically self-funded plans, and what they're doing to monitor their vendors, how they're choosing their vendors, how they're ultimately choosing to pay their vendors, whether the vendors are really doing what they need to be doing on behalf of the plan. So due diligence, not only in picking their vendors, but also in monitoring their vendors, and then these ones, specifically around the prescription drug coverage. And that ultimately, if the employers aren't doing their job as the plan sponsors, that is hurting the participants, that they are potentially overpaying for coverage or not getting the coverage that they should get. The Johnson & Johnson case was originally dismissed for lack of standing. We actually saw that it was just recently refiled. So they dismissed it originally, saying that the plaintiff that they brought, that they weren't able to really prove any damages or harm, and so they dismissed the case for lack of standing. They restated things and kind of what they thought the damages were and the harm to the plaintiff, and refiled, and then they also added another plaintiff to the case. So we'll see now, if they can get around that dismissal and get some traction with the case now as it's being refiled. And then the JP Morgan is just a similar case. Ultimately, what would this mean for employers as plan sponsors? It's just going to really heighten kind of paying attention to your responsibilities to ultimately act on in the best interests of plan participants, making sure that you're choosing, going through and making decisions that make sense and providing the coverage that makes sense for plan participants and the vendors and things, especially for self-funded plans, that you're being thoughtful about who you're choosing to put in place to help administer that plan and monitor them and ask questions about how that's being done to make sure, again, the whole idea behind it is just acting in the best interests of the plan participants. We're also watching, there have been lots of wellness lawsuits. Primarily, they've been focused on tobacco surcharges, which is a flavor of a HIPAA health contingent wellness program. Basically arguing that in these situations, the HIPAA rules are very clear that the plan is supposed to offer a reasonable alternative standard to those who can't meet the initial requirements. So for example, for a tobacco surcharge wellness program, for those that indicate that they are smokers or tobacco users, the employer would have to offer an alternative. So go to a cessation class, use cessation products for a period of time, and that ultimately, if you do that, you can avoid that surcharge. So providing that reasonable alternative standard, and then also providing notice of that reasonable alternative standard, and between those two different requirements, seeing some real misses, along with a very significant surcharge, which then is not permitted if the employer isn't following these rules. So a reminder that if you've got a wellness program in place, to make sure that you are thinking about the HIPAA wellness rules, as well as the ADA's or EEOC's wellness rules, and making sure that your plan is in good shape around those. Then switching to state laws and regulations. And this is where, again, I think we're going to continue to see more and more of this, especially if they deregulate at the federal level. Unfortunately, this does make it a little bit harder for employers that more and more often have kind of a national footprint. Even if you're a smaller to mid-size employer, the reality is we're seeing more and more employers hire remote employees that then you may find yourself subject to different state laws because of that. It really just kind of depends on the makeup and how the laws are written. Pharmacy benefit managers, that's one thing that we're seeing here for the most part. The insurance carriers are going to coordinate with the pharmacy benefit managers as needed, but for self-funded plans, there has been some real struggle. Most of the time when they're subject to ERISA, we argue that they don't have to comply with the state level laws, and we've seen a little bit of pushback. We've seen the Supreme Court, looking to have the Supreme Court weigh in here because they've been challenged at the state level, and ultimately we've found in some cases, and we've got an Oklahoma case that we're listing here as an example, that they said that it wasn't preempted by ERISA. So there's some real confusion here around how to comply, and as we see the different states really going after pharmacy benefit managers, licensure, gag clauses, pharmacy networks, looking at kind of regulating the rebates and cost sharing, just trying to really understand, at least for self-funded plans, where we can claim ERISA preemption or not, where we have to comply with the different reporting requirements or not. So we'll have to watch and see how this one plays out. And then finally, this is one that I know many employers are really struggling with, not only from the specific benefits aspect, but also from kind of the HR kind of management aspect of things around leave, and seeing more and more things at the state and local levels around family and medical leave protection. So this is another one that we're just really continuing to watch, and until we have a national standard, having to really go state by state. So these are just kind of two examples, but again, wanted to just illustrate that as we don't have the national standards, whether it's preventive coverage or whether it's other things, that we'll see states jump in and say, this is what we're going to do here, and then putting employers in kind of a tough position trying to figure out which ones do we have to follow depending on where we have employees, whether our plans are fully insured or self-funded, and just having to kind of continue to navigate that and get our arms wrapped around that. So with that, that is what I was going to cover today. I just was looking at questions. I don't see anything else there that has come in, but we really covered a lot of different stuff. I know we didn't give you anything real concrete that you can take away and say, okay, this is what we have to do now. That really wasn't the intent today. We were really just trying to help you understand all of the different places that we have to really watch and pull things from, and that a lot of things are in flux right now, especially with the new administration coming in and just kind of having to watch and see how this plays out. But we really encourage you, if you have questions about any specific pieces, that it would be absolutely appropriate to go back to your assured partner or broker and work with them. Ask them questions about some of these particular pieces that you think could ultimately impact your offering, or if you're interested in making changes and want to know if you would be able to do that. Totally appropriate to reach out to them and just kind of work through those specific questions with them. But with that, I'll turn it back over to you, Jenny.
Thank you, Reagan. You did a great job pinch hitting for Amanda, and we haven't seen her, so we are wishing her luck as she struggles with issues that I'm sure we can all relate to. And thank you to our audience for your flexibility. Glad you could join us this afternoon. And as a reminder, we did record today's webinar, so a link to the recording will be available early next week from that benefits advisor who invited you here today. And as Reagan said, they would be a great resource if you want to dig in more on anything that was covered today, or even any of those topics that we asked in the polls. So this does conclude our time together. Thank you again to our AssureXGlobal partners for sponsoring today's event. Thank you to our audience for joining us, and have a wonderful afternoon.